It's Wednesday, February 17th, and the time for your Barbados Today morning news update. Health authorities to deliver a statement today on Sunday's death of a 9-year-old child at the Queen Elizabeth Hospital from complications of COVID-19. Media reports out of Trinidad claimed the child died from a condition called multi-system inflammatory syndrome in children brought on by the coronavirus. In Tuesday's COVID-19 update and dashboard issued by the Barbados Government Information Service, the child's death was confirmed as COVID-19 related. When Barbados Today contacted Chief Medical Officer Dr. Kenneth George, he said a full statement would be provided today. The child's death was listed among two others, a 74-year-old woman from a nursing home and an 88-year-old woman with pre-existing medical issues. These deaths bring the total from the virus to 28. There were 128 new COVID-19 cases recorded on Monday, February 15th, comprising 58 women and 68 men. The new cases include results of samples from over a 12-day period. There are now 731 active cases on island. The national COVID-19 count now stands at 2,457, comprising 1,090 females and 1,367 males. 1,698 persons have recovered. The director of Barbados' Psychiatric Hospital pushes back against suggestions that staff, particularly nurses, are skeptical about taking the Oxford AstraZeneca vaccine. David Leacock believes it is perfectly reasonable for even frontline healthcare workers to seek further information and conduct independent research before accepting the jab. Leacock tells Barbados Today in the first week of the vaccination rollout, the psychiatric hospital fell just short of its 20% target, with just 89 of the 430 members of staff accepting the vaccine.
I myself would have had the vaccine on Friday, and I would have had just a mild soreness to the arm. But other than that, no other side effects were observed. And in speaking to staff, they said they felt a lot more comfortable knowing that some of us had actually had the vaccine and that we didn't have any side effects. So they have actually said since then, they put their names down to be the next set of persons to be vaccinated. Beyond that, they said most persons, for the most part, have done their reading and have been satisfied that the vaccine doesn't pose a major risk to them. But again, as I said, it is new. If anything that is new, there is a time period for persons to feel comfortable before they actually take the vaccine. So we're just giving the person a chance to get comfortable with the whole situation. We're not trying to force it. It's still a voluntary system. So we are giving staff the opportunity to become educated on their own way. And where possible, if they have any gaps that we can fill in for them, we do that.
Members of the transport sector want a seat at the social partnership table, and Communications and Marketing Manager of the Alliance Owners of Public Transport, Mark Haynes, is calling for Prime Minister Mia Mottley to urgently meet with officials from the sector to chart the way forward. Haynes tells Barbados Today the lockdown had seriously impacted the finances of PSV operators who are limited to carry 60% of their maximum passenger capacity, and some form of financial assistance should be given to workers.
But the sector really needs help, and I think the government of Barbados owes it to us, the Prime Minister. I call on her to politely meet with us and have a frank, open, and civil discussion with us, since we play a major role in to Barbados' GDP, and moreover to the transportation system in Barbados. Let's not fool ourselves. This sector has been here for a while. Notwithstanding, government would have gotten the EV buses and so on. But before that, what was happening? When the government was in a situation, they called on the sector to assist them. Hence, they had the system, which is the TAP system, yes, of course, and they rely heavily on the sector. So you just can't throw us under the curve. We are deserving of help like any other sector in Barbados. And this thing about only having people fit in social partnership, we should be part of that social partnership. We should be able, when government convenes in a meeting at that level, the PSV sector should be there to make representation on its behalf.
He also put forward an option to help ease the burden.
I think that government should also look perhaps at having a moratorium for the taxes to be paid for this year. Given that the guys are not making a lot of money, the shop, there was no fault of their own or no one's own. I'm not blaming them for this either. But I'm only saying, given the precarious nature in which the operators find themselves, I think it's only fair to issue a moratorium for this year's permit fees, payable to the Cabra. The government should look to waive the fees for this year, and when next year picks up, then they can obviously revert to, because they may get persons then, in which case they will pay for the year. But I feel this is one of the ways and means of cushioning the impact which the operators are having. But it's really hard and it's troubling.
There's regional and international news after this short break.
Barbados Today, news you can trust.
The developments in the region now. St. Lucia's chief medical officer tells residents not to let their guard down as the country continues to record a spike in COVID-19 cases. More from HTS News Force.
Health officials have noted a slight drop in COVID-19 cases and rates. However, Chief Medical Officer Dr. Sharon Belma-George warns citizens to stick with the protocols to maintain that trend. St. Lucia's COVID-19 curve peaked in January 2021, which led to the island surpassing 1,000 cases. Dr. George says if persons let up on the measures, this may lead to a similar situation.
So we are not in a position to relax. We are not in a position to get back into normal life. We have to ensure that we remain vigilant, we maintain all of the protocols that are in place. As much as possible, we avoid social gatherings because we are still at a point where the numbers can go back to what we have seen between the middle of January, where the numbers, this was our highest peak to date.
The government placed the island under a state of emergency to impose a curfew to restrict movement and slow the spread of transmission. The authorities also decided to scale down operations.
The World Health Organization is reporting that close to 300 Ebola contacts have been identified in the latest outbreak in the Democratic Republic of Congo and 109 more in Guinea. The update on the spread and tracking of the disease from the WHO's spokesman Margaret Harris comes on the heels of the latest resurgence of the disease in West Africa.
We now know there are 7 cases, 3 confirmed, 4 probable in Guinea, and 3 of those have died. We have identified 115 contacts, and the majority of those have been traced. That's 109. The contacts are in Zarakoya, but also in Conakry. We also have an outbreak going on in North Kivu. There is no connection between the two. We've not seen any evidence of any connection there, but they are going on at the same time. What is critical is decentralizing the operations to the lowest level, making sure your operations are where the community are, and that the community owns the operations, that your work is community-centered and that you work with the community.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.